Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Monoamine oxidase B inhibitors. Monoamine oxidase B inhibitors. There are two isoenzymes of monoamine oxidase. We have monoamine oxidase. Monoamine oxidase is of two types. We have monoamine oxidase 1 and monoamine oxidase 2. Both these are actually present in peripheral adrenergic structures and intestinal mucosa. But both these are present. The sites of both of them are peripheral adrenergic structures. They are present in peripheral adrenergic structures and they are also present in intestinal mucosa also. But the main important thing is monoamine oxidase B is mainly present in the brain and also it is present in the blood and also in the platelets. Then monoamine oxidase A. This monoamine oxidase A will mainly metabolize the norepinephrine. It metabolizes the norepinephrine, it metabolizes the serotonin, and it also metabolizes the dopamine. Whereas monoamine oxidase B, this will mainly metabolize the dopamine only selectively. This will only metabolize dopamine, not the other agents. So, if you give a monoamine oxidase B inhibitor, obviously this will block the dopamine metabolism, thus increasing the availability of dopamine in the brain. So, the drugs which are monoamine oxidase B inhibitors, drugs are actually we have two drugs which is selegiline and rasagiline is seen.
thank you and thank you for watching.